We continue following that breaking Broncos news this afternoon. Linebacker Alex Singleton is recovering from surgery for testicular cancer.
Right now, we're joined by Dr. Nicholas Koss, CU Anschutz, Associate Professor of Surgery-Urology. Doctor, thanks so much for taking the time. The detection of his tumor came relatively early from a drug test. How common is that?
Yeah, that's a slightly unusual circumstance. We don't typically see men getting this sort of test as a screening modality. So more typically, you would see a guy pick something up at home on a self-exam or with their primary care doctor, and then get this test done.
I've heard so much about self-exams. I want to touch on that, but also they talked about this protein HCG that was found in this blood test. What exactly is that, and why would that raise a red flag with a doctor?
Right. So HCG is part of a fairly complicated cascade of endocrine proteins that ultimately lead towards testosterone, in this case, in the testicle. And it is something that we know that certain kinds of testicular tumors will secrete. And so we use that to both detect and then follow men that have testicular cancer. However, it's really not a great screening test. It's only elevated in a proportion of patients with testicular cancer. So the better way really is if something is felt, to go to an ultrasound that can visualize if there's a mass in the testicle or not. We definitely don't want to give the message that men should be going out and asking their doctors to get an HCG test, in their office. Really, the better thing to do would be to go over the testicular exam with a physician, and then if something out of the ordinary is felt, to get imaging.
You know, the great thing about someone being as courageous as Singleton is, coming forward, talking about this, because he doesn't need to, it gets the conversation going. And while we're having this conversation, for folks who are new to it, how common is testicular cancer, and is there a percentage of when you find a tumor, is it benign or malignant?
Yeah. So testicular cancer happens in around 1 out of every 400 men in their lifetime at some point. So it is something that we we'll hear around young professional athletes, because the age range that we see it is men between the age of 13 and 39. So, nearly every year we're hearing of some sort of professional athlete around the country being diagnosed with this. There's around 9,000 to 10,000 cases a year in the U.S. And I think your first point was really well taken. It's very courageous of Alex to bring it up and destigmatize this, because you're dealing with a population of patients, young men who may not be really comfortable with going to physicians or talking to their family or friends about something like this. And so it may go quite a while undiagnosed. And so I really applaud Alex for doing this, because I think it will encourage men to be more aware of their health and feel more comfortable bringing it up with either friends or their physician, hopefully, if they feel something.
That makes so much sense. I mean, you think about that, young men look up to somebody like him, but we have had some famous athletes. I think of Lance Armstrong, I think of Scott Hamilton, and athletes are so physically fit. And like he said, I'm so careful about everything that goes in and out of my body. So that's really kind of scary. What are the treatments? He talked about surgery. What else is going to happen?
Yeah, so it'll depend on his staging. So after the pathology comes back, exactly what kind of testicular cancer it is, and then they'll do a scan of his chest and abdomen and pelvis and see are there any signs that it had spread outside the testicle. Most commonly, that would be to lymph nodes that are near the kidney or onto the lungs. And if there are no signs that it's spread anywhere else, it could be just scans and labs to see if it does show up that it has spread. Or if it has spread already, it could include surgery or chemotherapy, or in a very small group, radiation. The good news is that it's very treatable. The cure rates are extremely high, but that doesn't decrease the sadness and the trauma that it induces in the patient. And it's actually something that we spend a lot of time talking with patients, because they've just had this very traumatic thing happen. They've been diagnosed, but yet we're telling them you're going to do great. And those kinds of mixed messages are difficult to wrap your mind around. And so we do spend a lot of time focusing on patients' mental health, their survivorship experience, doing sperm banking, so that if they've not yet had the opportunity to have a family, that they can go on and do that despite any treatments that happen. So it becomes very personalized once you get that staging imaging and the pathology back. So I can't speak specifically to what will happen for him. The good news is that there are a lot of things that can be done. I think very likely this is curable, but that doesn't diminish how devastating it can be for a patient. And I really, again, applaud him for, in this moment that I'm sure is tough, that he's reaching out and making people aware of it. It's really, I would never say that this is a good thing, but there are good things that can come out of it. And he's shown that today.
Absolutely. And as we said, it's incredibly brave, and it gets this conversation on the news, and folks will see it. If it saves just one person, then it's completely worth it. Dr. Nicholas Kost from CU Anschutz, thanks so much for taking the time to speak with us.
Thank
Appreciate
you.
it.